Hello everyone, this is Dr. Prashant and welcome back to my public health series. In the last video, I discussed about paper 1. In this video, I'll talk about paper 2 along with clear explanations wherever needed, and we'll share some tips and strategies for scoring more marks. Without any delay, let's start with the first question. To start with the question number 51, this question is about effective literacy rate. So the formula for effective literacy rate is number of literate persons aged 7 and above divided by population aged 7 and above multiplied by 100. So in this case, the denominator will be population aged 7 and above. So the correct answer is option 3. Now coming to question number 52, which is a match the following regarding SDG target for NCDs. So I have already clearly mentioned about all SDGs and MDGs in my SMCH notes. So please go through it. So the correct answer should be option 2. Now coming to question number 53, extensive limb swelling following DTP vaccination. This adverse event following immunization can be classified as. So it's very simple. It's basically vaccine product and its related reaction. So it's not related to any vaccine defect or immunization errors. So it's just normal vaccination and its side effect. So the correct answer should be option 2. Now coming to question number 54, where they are asking to arrange in increasing order of the requirement, that is from lowest to highest in terms of grams required per day as per ICMR Dietary Guidelines 2024. So the correct sequence should be fats and oils followed by pulses and beans followed by green leafy vegetables, and the last should be cereals and millets. So the correct answer is option 2. Now coming to question number 55, where they are asking about 5 key action areas in health promotion given in Ottawa Charter 1986. So except public-private partnership, rest all are correct. So the correct answer should be option 4. Now coming to question number 56, which is a match the following about barriers of health communication and its examples. So in this case, you just need to solve A and B. So it's very easy question. Cultural barrier is customs and environmental barrier is noise. So if you can solve A and B, you don't need to look at the other options. Now coming to question number 57, which is about first referral unit or FRU. They're asking to find the critical determinants of a facility being declared as FRU. Except safe abortion services, rest are correct. So the correct answer should be option 2. Now coming to question number 58, which is about models of health education. So basically there are 3 models or approaches. One is medical, motivational and social intervention approach. So except regulatory approach, all are correct. So the correct answer should be option 3. Now coming to question number 59, which is a repeated previous year question on type of blindness and its definition. So the correct sequence should be A4, B2, C3 and D1. Always remember, economic blindness should be inability to count fingers at a distance of 6 meters, and absolute blindness is nothing but state when there is no light perception. Okay. And now coming to question number 60, which is again a direct question. So they are asking you to find out the countries which are part of WHO CRO region. So the correct answer should be Indonesia and Thailand. So correct answer is option 1. Now coming to question number 61, which is again a direct question on case control study. It is very easy because we all know that case control study starts from effect to cause or from disease to exposure, right? So the correct option should be it is suitable for study of rare diseases. So option 3 is correct. Now coming to question number 62, which is again a very easy question, and I already made a special video on critical path in my YouTube channel. So I'll provide the link in the description. Please go through it. So critical path is nothing but the longest path in a project. Okay. So in this case, the longest path should be A, B, C, F and G. So if you count the number of days, 2 plus 5 plus 5 plus 3, the critical path should be 15 days. So option 1 is correct. Now coming to question number 63, which is about basic principles of medical ethics. Again a very easy question. The correct answer should be patient's autonomy and do no harm to the patient, that is non-maleficence. So the correct option should be option 1. Now coming to question number 64, which is a chronological question on nutritional programs and their years. So the sequence should be public distribution system followed by ICDS followed by Annapurna scheme, and the last should be National Nutrition Mission, that is Poshan Abhiyan, which was launched in 2018. The sequence should be BACD. Now coming to question number 65, which is a match the following question on organization and establishment year. Again a direct question, just check for Food and Agricultural Organization. So which was started or established in 1945. So you don't need to check all options as there is only one option with D as 2, that is Food and Agricultural Organization, that is 1945. So the correct answer should be option 3. And now coming to question number 66, which is on health education. Which method is best suited to teach mother oral rehydration technique for her child? It is very easy. The answer is demonstration. So option 1 is correct. Now coming to question number 67, which is regarding Poshan Abhiyan objectives and targets. So in this case, option C is wrong because they have given 6%. It's not 6%, it's 9%, which comes to 3% per year. So correct option should be A, B and D. Option 3 is correct. Now coming to next question, that is question number 68. They are asking to find out the incorrect statement about IPHS 22. So in this case, option 3 is wrong. What is option 3? CHCs in urban areas can be both FRU or non-FRU, which is false because urban CHCs must be in FRU category. Non-FRU CHCs are explicitly in rural areas. Now coming to question number 69, which is about health workers posts that come under the Ministry of Health and Family Welfare. The correct option should be ANM and CHO. So option 3 is correct. Now coming to question number 70, they are asking daily duration of sunlight exposure required for sedentary pregnant women for vitamin D as per dietary guidelines of ICMR 2024. So the answer is 15 minutes. Option 2 is correct. Now coming to question number 71, they are asking to find the incorrect statement regarding recommendations for sedentary pregnant women as per dietary guidelines of ICMR 2024. So in this case, the incorrect option is take sleep immediately after every meal. So the correct option should be option 3. Now coming to question number 72, which is again a chronological question. So in this case, the correct sequence should be germ theory of disease followed by discovery of Vibrio cholerae, then followed by transmission of African sleeping sickness, and the last should be the transmission of malaria by Anopheles mosquito. So the sequence should be B, D, A and C. And now coming to question number 73, where they have conducted a study on physicians. About 22,000 physicians participated and they tested aspirin for primary prevention of cardiovascular disease. This is one part, and beta carotene for primary prevention of cancer. This study was an example of. So basically it's an RCT, that is nothing but randomized controlled trial, but the design was 2x2 factorial design. So what is factorial design? Factorial design is nothing but we test 2 or more interventions at the same time in the same study using all possible combinations. So this is an example of factorial design. And now coming to question number 74, which is a match the following question on type of communication and its example or feature. So one-way communication comes to didactic method, two-way Socratic method, and third informal communication is the grapevine, and the non-verbal communication is the frown. And now coming to question number 75, they are asking you to find the characteristic of health education as compared to health propaganda. So what is health education? Health education aims to create understanding and change behavior through reasoning and active participation. So it appeals to reason and encourages thinking and informed choice. Whereas health propaganda, it tries to influence people emotionally, often spoon feeds the information and discourages independent thinking. So the correct answer should be appeals to reason, that is option 1. And now coming to question number 76, that is on MTP Act. In this case, option A is wrong because it's not 20 weeks, it is 24 weeks for rape survivors. And now coming to option B, which is also wrong because we just need advice of one doctor if the gestational age is between 12 to 20 weeks according to MTP Act 2021. Please watch my video on MTP Act as I clearly mention the differences between MTP 1971 and 2021. So in this case, the correct option should be C and D, that is option 3. And now coming to question number 77, which is a match the following question on heterogeneous chain infection and vector-borne diseases. Option A is very easy, that is schistosomiasis, and there are only 2 options that are starting with A3. So in both options, C is given as 4. So you don't need to check C. So now option D can't be fish tapeworm as there is only snail and crab as intermediate hosts. So the final correct answer is option 4. So A3, B1, C4 and D2. That's how you can save some time. And now coming to question number 78, which of the following is an exception of optimum use of health investment? So what is optimum? Optimum use of health investment means efficient, fair and cost-effective spending. But catastrophic health expenditure is nothing but when a family spends a very large of income on healthcare, which leads to financial hardship or poverty. So it is not an indicator of optimum investment. So the correct option should be option 4. Now coming to question number 79. Arrange from lowest to highest of the saturated fatty acid content according to ICMR. So the highest content is seen in coconut oil and the lowest saturated fat is in mustard oil. So the sequence should be mustard, groundnut, vanaspati and coconut oil. So option 2 is correct. And now coming to question number 80, that is on rapid sand filters. In this case, option A and D are correct. That is, they occupy less space and has the highest filtration rate compared to that of slow sand filters. And now coming to question number 81, which is a direct question on SDG targets. I have already mentioned all SDGs and MDGs in my SMCH notes. Please go through all the important indicators because it is very important and most repeatedly asked question. And now coming to question number 82, find the correct statement regarding IUD devices. So in this case, option B and C are correct. And always remember, copper devices cause more bleeding compared to that of levonorgestrel devices. And now coming to question number 83, they are asking to find the range for the number of years required for the population to double in size. Growth rate was given between 0.5 and 1%. So there is only one simple formula. Doubling time in years is equal to 70 divided by annual growth rate. So in this case, the growth rate is 0.5 and 1%, right? So 70 divided by 0.5 and 70 divided by 1. So that will come to 140 years and 70 years, right? So option 3 is correct. And now coming to question number 84, they are asking the full form of PPT-CT. It is nothing but prevention of parent to child transmission of HIV. So it is part of National AIDS Control Program, NACP. And now coming to question number 85, which of the following is the type of conflict management? So that is avoidance mode of conflict management. So the correct answer is diffusion. So what is diffusion? It means avoiding or minimizing tension between conflicting parties without directly solving the issue. A simple example, by changing the subject or postponing the discussion or separating people who are involved in the conflict. So it is an avoidance style of conflict management without directly solving the issue. So option 1 is correct. And now coming to question number 86, which is a direct match to the following question. You just need to check only one option, that is option D, social rehabilitation. So it is nothing but aim to restore family and social relationship. So there is only one option with D as 2. So the correct option should be option 3. So this is how you can save some time in the exam. And now coming to question number 87, they are asking about domains of learning. So there are 3 classic domains of learning according to Bloom's taxonomy. One is cognitive, next is affective and third is psychomotor. So in this case, functional domain is something wrong. So it is option C. Now coming to question number 88, they are asking to arrange in the order of population catered. So that is from Mahila Arogya Samiti followed by Asha, Urban Ayushman Arogya Mandir and Urban Polyclinic. So I have given the population covered in the below table. Please go through it. And now coming to question number 89, that is on toxoid vaccine. So what is toxoid vaccine? It is an inactivated toxin that retains its ability to stimulate immunity. So in the national immunization schedule, toxoids are used for diphtheria and tetanus. So let's look at other options also. Pertussis, we see killed or acellular vaccine. Hepatitis B, we see recombinant vaccine. In measles, we see the live attenuated vaccine. And now coming to question number 90, which of the following can be used for the representation of correlation between two continuous variables? The correct answer should be scatter plot, because a scatter plot shows the relationship between two continuous variables by plotting data points on the XY graph. So the pattern of points, for example, upward, downward, indicates whether the correlation is positive or negative. The closer the points from a line, the stronger the correlation. Let's also understand the example for continuous variable. It is very simple, weight of individuals or height of the individual. And now coming to question number 91, which is about group discussion in health communication. So they have mentioned less than 6 members. That is wrong, because effective group discussion always need around 6 to 12 members. So final answer should be option 1. And now coming to question number 92, which is about yellow fever vaccine, route of administration. So the route of administration is through subcutaneous and the quantity is 0.5 ml. So now coming to question number 93, it is again a very direct question on WASH. It is safe water, sanitation and hygiene. And now coming to question number 94, which is again a direct match the following question. So the correct answer should be A3, B4, C2 and D1. And now coming to question number 95, again a direct question on folate rich foods. So the correct answer should be T because it is not rich in folate. And now coming to question number 96, they are asking to arrange the elements of filter box of a slow sand filter from top to bottom. So it is supernatant water, sand bed, gravel support and filter bottom. And now coming to question number 97, that is on quantitative goals and objectives of National Health Policy 2017. So in this case, only option 4 is correct. That is, catastrophic health expenditure has to be reduced by 25% by 2025. Under 5, it is 23 per thousand live births, and access to safe water and sanitation, it is universal access by 2020. And life expectancy at birth increased from 67.5 years to 70 years by 2025. So only option 4 is correct in this scenario. And now coming to question number 98, which is related to the concept of vertical social mobility. So vertical social mobility is nothing but a person moves up or down in social or economic status. So let's look at option 1, that is change in social class, which is correct. Change in occupation, which is also correct. And third option, that is migration of doctor to another district, which is same status, so it's not vertical. So option C is wrong in this scenario. In the last option, that is farmer's son become a collector, which is clean upward mobility, right? So only option C is wrong in this example. And now coming to question number 99, again a chronological question on health committees, which is very direct and easy. They're asking from oldest to recent. So Chadha committee, followed by Kartar Singh committee, Mehta committee, and the last should be the Bajaj committee. And now coming to question number 100, again a direct question on HFSS. So HFSS is nothing but it stands for high fat, sugar and salt foods. So option 2 is correct. Now coming to question number 101, again a direct easy question on essential functions of a family. So only religion is not the essential function. And now coming to question number 102, which is on transplantation on Human Organs and Tissues Act 2011. So in this case, the correct statement should be B and D. That is, donor below 18 years cannot donate, which is true. And the option D, that is grandparents and grandchildren included as near relatives, which is also correct. So now coming to question number 103, which is about the Indian Newborn Action Plan sequence. So they're asking the sequence from lowest facility to highest level. So it starts from injectable gentamicin by ANM, followed by Newborn Stabilization Unit, NBSU, followed by Sick Newborn Care Unit, SNCU. The last should be the Newborn Intensive Care Unit, that is NICU, which is located at tertiary or medical college. And now coming to question number 104, which is a direct question on proportion of population with access to improved drinking water. It is 90%. And now coming to question number 105, it is a question on TB elimination program facility, asking the order from lowest to higher level. So first it starts from DMC, that is nothing but Designated Microscopy Center, followed by CDHT, that is Culture and Drug Susceptibility Testing Laboratory, and third is the Intermediate Reference Laboratory, that is IRL. The last should be the National Reference Laboratory, that is NRL. And now coming to question number 106, which is a question on management technique that is not used for time management. It is very easy question. It is EOQ. EOQ is nothing but economic order quantity. I already made a special video on this. Please watch it. It determines the most cost effective order size for inventory, but it is not related to the time management. And now coming to question number 107 on steps of planning cycle from start to end. So it starts from formulate health problems, followed by define program objectives. Next is programming and implementation. And the last should be the monitoring. And now coming to question number 108, that is about urban HWC PHC as per IPHS guidelines 2022. I have a doubt on this question. I feel option A and B should be correct, but they have given a different option. Please check it again. And if you find any valid information regarding this, you can post it in the comment section. And now coming to question number 109. On the type of need theory of motivation, the correct answer should be ERG theory. It is nothing but it's a content theory which focuses on needs, that is existence, relatedness and growth. And now coming to question number 110, they are asking to find the not an example of indirect method of disease transmission. Very easy question. Answer should be vertical transmission. Vertical transmission comes under direct transmission, simple example from mother to child. Indirect transmissions include vehicle-borne or vector-borne diseases. And now coming to question number 111, again a chronological question on year of establishment of voluntary health agencies in India. So first should be All India Blind Relief Society, followed by Family Planning Association of India, next Bharat Sevak Samaj, and the last should be Central Social Welfare Board. So correct sequence should be C, B, D and A. And now coming to question number 112, which is on how much IV rehydration for infants with severe rehydration. So the correct answer should be, first we need to give 30 ml per kg in 1 hour, followed by 70 ml per kg in the next 5 hours. And now coming to question number 113, which is a question on test to measure the inter-observer variation. Correct options are percent agreement and the kappa statistic. So option A and option C. And now coming to question number 114, which is a question on measures of maternal mortality. So it is only maternal mortality rate which captures both risk of death per pregnancy and fertility level in the population. So the correct answer should be MMR, that is maternal mortality rate. And now coming to question number 115, which is again a chronological question, a direct question. First should be Child Survival and Safe Motherhood Program. Second, Reproductive and Child Health, that is RCH in 1997, followed by RMNCH plus A, and the last should be the India Newborn Action Plan, that is 2014. And now coming to question number 116, which is on indicator and target. So in this case, indicator should be proportion of persons who are smokers and target should be reduced from 20% to 10% in next 1 year. And now coming to question number 117, which is again a direct match the following question on environmental condition and percent of global population. So correct option should be 4312. And now coming to question number 118, they are asking you to find the denominator used to calculate dependency ratio. So the formula for dependency ratio is, in the numerator we take population age 0 to 14 plus population age 65 plus divided by population between 15 to 64 multiplied by 100. So in this case, the denominator should be population age 15 to 64 years, that is nothing but the working age population. And now coming to question number 119 on suggested crude protein intake in grams from lowest to highest. So option 2 is correct, that is B, A, D and C. And now coming to question number 120, which is again a simple match the following. So you can look at first option, that is disability, it is cannot walk. Second is handicap, unemployed. Disease, that comes under accident, and impairment is nothing but the loss of foot. And now coming to question number 121, which is on Blade and Mountain managerial grid. So what they are asking country club management is characterized by what? So the correct answer should be low concern for task and high concern for people. So in simple words, a friendly manager always focus on keeping everyone happy and comfortable, but gives less attention to the work performance or productivity. So low concern for task but high concern for the people. So there are other leadership styles also. You can go through them, 1, 1, 1, 9 and 9, 1, that is high task for low people, 5, 5 that is moderate task for moderate people, and 9, 9 is nothing but high task, high people. And now coming to question number 122, which is on features of a joint family. Again a very simple question, mutual rights and obligations and common residence. And now coming to question number 123, which is again a very easy question, presence of insect vectors on the body or mucous membrane. It is infestation. And now coming to question number 124, which is again an easy match the following question. Just look at the regulatory approach and you don't need to solve other options. Regulatory approach is nothing but through external controls or laws. So option 4 is correct. And now coming to question number 125, which is again a chronological question, starting from scurvy, cowpox and mosquito transmission of yellow fever, and the last should be the pellagra. And now coming to question number 126, which is on concept of health education. So in this case, educating children about avoiding open defecation, they influence their parents, uncles and grandparents, and that lead to whole community adopting to better sanitation. So this comes under ascending education. So what is ascending education? Health message starts from children or lower groups and then move upward, that is towards influencing parents, elders and the whole community. And now coming to question number 127, which is on case fatality rate. Again a very easy and direct question. Correct option should be it represents the killing power of disease And next option should be typically used in acute infections. So case fatality rate is nothing but the number of deaths due to a disease divided by number of diagnosed cases of the disease multiplied by 100. It is very important. Please remember the formula. And now coming to question number 129, which is again a very simple and repeated question. Please go through the options. It has to be A3, B4, C2 and D1. And now coming to question number 130, which is again on health committee, where reorientation of medical education scheme started. So it was started in 1977 and it was based on the recommendation of Srivatsav committee. And now coming to question number 131, that is on physical quality of life index. So it has three components. One is IMR, that is infant mortality rate. Second is life expectancy at age 1. And third is literacy rate. So the correct option should be option 3. And now coming to question number 132, it is a match the following question on intervention and level of prevention. Again a very easy question. Screening for hypertension comes under secondary prevention. Provision of calipers after paralytic polio, that comes under tertiary prevention, and chemoprophylaxis for malaria, that comes under the primary prevention. So this is a repeated question. Please remember chemoprophylaxis for malaria, that comes under primary prevention. The next one, that is avoidance of antibiotics in common viral infections, that comes under the quaternary prevention. And now coming to question number 133, which is again a very easy question. They are asking which among the following causes neuromuscular symptoms in food poisoning. It is Clostridium botulinum. And now coming to question number 134, which is a match the following question on scheme and intervention. So first is Lakshya, that is to improve quality of care in labor room. Next is mother's absolute affection, that is to promote optimum infant and young child feeding practices. And Vande Mataram scheme is for safe motherhood practices. And Kilkari is nothing but a IVR based mobile service which provide audio messages on pregnancy and child health. And now coming to question number 135, which is on steps in outbreak investigations, which is again a repeated question. Very easy. Confirm existence of outbreak, followed by develop the hypothesis. Third is test hypothesis, and the last is the writing the report. And now coming to question number 136, that is on surveillance system. It always aims to detect the high risk groups, okay, not the low risk populations. And now coming to question number 137, again a very easy question. Sources of surface water. It is impounding reservoir and tank. And now coming to question number 138, again a direct easy question. The correct answer is Zika virus. And now coming to question number 139, which of the following are at village level? Option A, B and D are correct options. Panchayat Samiti, it is at block level and not at the village level. And now coming to question number 140, which is on disaster management, and again a very easy question. Reducing the impact of natural or man-made disaster on a nation or community. So what is it called? It is disaster mitigation. And now coming to question number 141, from here we can see numericals, and this time the numericals are comparatively easy. You can easily solve these questions. So coming to the first question, so they are saying that if the prevalence increases, what happens to the PPV and NPV? Always remember, if the prevalence increases, the positive predictive value, that is PPV, increases, whereas the NPV decreases. And now coming to question number 142, they are asking you to calculate the sensitivity. Again a very easy and direct question. Sensitivity formula is nothing but true positives, that is TP, divided by true positives plus false negatives, TP plus FN multiplied by 100. So in this case the true positives is 4000 divided by 4000 plus 1000 multiplied by 100. And now coming to question number 143, that is specificity. Again a very direct and easy question. So in this case, in the numerator, we take true negatives, that is 76,000 divided by true negatives plus false positives, that is 76,000 plus 19,000. I think it comes around 95,000 and multiply by 100. That's it. And now coming to question number 144, they are asking you to calculate the positive predictive value or PPV. Always remember, for PPV or NPV, that is negative predictive value, you need to look horizontally on the table. So in this case, the formula should be true positives divided by true positives plus false positives multiplied by 100. So 4000 divided by 4000 plus 19,000 multiplied by 100. That's it. Now coming to question number 145, which is also a very easy question but slightly twisted. So what they are saying, only the individuals who test positive on both the tests are labeled as screening positive. So this type of screening is called serial testing. So what they do in serial testing, both tests must be positive to call someone deceased. So if a person truly has the disease But in the first test he was positive and in the second test he was negative. But still that person is counted as disease free because he need to test positive in both the tests. So because of this, the sensitivity decreases and the specificity increases. And now coming to question number 146, again a new passage, and it is a repeated question. They have given this already multiple times in previous papers. If you have been through previous papers, this question would have been very easy for you. So let's see what data they have given. So the immediate population is given as 45,000. Crude birth rate is given as 20 per 1000 population. Okay. So number of live births will be 20 multiplied by 45. So that is 900 births. And the infant deaths are given as 30 and the neonatal deaths is nothing but deaths within first 4 weeks is given as 25. So you know the infant deaths and you know the neonatal deaths. So post neonatal deaths should be 30 minus 25, that is 5. So what they are asking you to calculate, they are asking you to calculate the post neonatal mortality rate. So the formula is something in the numerator, post neonatal birth deaths, that is 28 days to 1 year divided by total live births multiplied by 1000. So in the numerator, we have already calculated the post neonatal deaths, 30 minus 25, that is 5 divided by total live births is 900, right? Because birth rate is 20 per 1000 population. For 45,000, the birth rate will be 20 multiplied by 45. So that is 900. So 5 by 900 multiplied by 1000. And now coming to question number 147, they are asking you to calculate the maternal mortality rate, that is MMR. So the maternal deaths are given as 8 and the women in reproductive age group, that is 15 to 49, is 6500. So let's understand the formula first. If they are asking you to calculate the rate, that is maternal mortality rate, in this case the denominator will be women aged 15 to 49 years. So the answer should be 6500. But if they are asking you to calculate the ratio, that is maternal mortality ratio, the denominator will be the live births, that is nothing but 900. So in the first case, for rate it is 6500, for ratio it is 900. And now coming to question number 148, they are asking you to calculate the approximate number of pregnant women. Again, this is a repeated question. They have asked it multiple times. Always keep in mind, you need to add 10% pregnancy wastage to the live births. So if you know the number of live births is 900, add 10% of wastage to it. That is 10% of 900. 900 plus 10% of 900, that will be 990. So the correct option should be 990. So most of the people, I think they have picked option 900, right? But always keep in mind, whenever you see these type of questions, always add 10% of pregnancy wastage, because not all pregnancies will lead to live births, right? They can include stillbirths and abortions also. So 900 plus 10% of 900, so that will come to 990. And now coming to question number 149, they're asking you to find the most important indicator for health status of a community. It is infant mortality rate, that is IMR, because it reflects not only the health and nutritional status of mothers and infants, but also the overall effectiveness of healthcare, sanitation, and socio-economic conditions of a community. So that's why we consider IMR as the most important indicator of health status of a community. And now coming to the last question, that is question number 150. They are asking you to calculate the late neonatal mortality rate. Very simple, formula based. The formula for late neonatal mortality rate is, in the numerator, deaths between 7 to 28 days divided by live births multiplied by 1000. That's it. So from the given passage, total births we know that is 900, and early neonatal deaths, it was mentioned in the passage that 15 died during the first week of life. That means less than 7 days. So number of deaths less than 7 days is equal to 15, and we know total neonatal deaths rate, that is 25. So if you subtract the early neonatal deaths from the total neonatal deaths, you will get the late neonatal deaths, that is 25 minus 15, that is equal to 10. So now we got the numerator, that is between 7 and 28 days. So in the numerator it is 10 divided by the denominator, that is number of live births is 900 multiplied by 1000. So the correct option should be 10 by 900 multiplied by 1000. I hope this is very helpful, and thank you.